Hello, this is Professor Wheeler. We're going to talk about dissociative disorders. This should be a fairly short lecture. So we have our objectives here. We're going to describe dissociative identity disorder, formerly known as multiple personality disorder. We're going to talk about dissociative amnesia and the three different types, and then also depersonalization derealization disorder. All right, so dissociative disorders are kind of an exaggeration of our normal processes. A lot of us, well, everyone daydreams, at least in my class, and that's a normal process. But that's just when you disassociate, it's much more extreme. So we have our three main dissociative disorders: dissociative amnesia, dissociative identity disorder, and depersonalization derealization disorder. So historically, Freud saw disassociation as repression, which is a defense mechanism to kind of protect you against threatening or unacceptable things in your life. It kind of keeps them out of your consciousness. So they're quite rare. Um, if you just went by movies and TV shows, you would think that wasn't the case, but they are more prevalent in women. And as far as depersonalization symptoms, those are more common in young adults in times of severe stress, and can be, well, I wouldn't say this because if it's brought on by a substance, then it's not considered depersonalization disorder, but that's the experience some people have when they're using ecstasy. All right, so assessment, talking about the dissociative amnesia. It's the inability to recall, your memories, and it's not just your normal forgetfulness just because you're getting older or you just woke up or something like that. It's not due to substance use, just like I previously said, and it's not dementia or delirium or anything like that. And it usually there's some kind of severe stress that happens that sets this in motion. All right, so there's three different types of dissociative amnesia. The first one is called localized amnesia, and that's when you can't recall everything about a traumatic event. This isn't like you don't know anything about yourself or your life. You just can't recall anything related to the trauma that you experienced for a specific period. Then there's similar but different is the second one, selective amnesia, and that's only when you can recall you can't recall only certain incidents associated with the traumatic event. Then we have generalized amnesia. This is the inability to recall anything that has happened during the person's entire lifetime, including who they are. This, I had a student years ago who she was doing okay now in our program, but 5 or 6 years before, she had woke up one day with no memory. She had no memory and didn't know who she was. Um, and so she was very lucky that her dad had a video camera when she was growing up, and she was able to, it helped to be able to watch those videos and get an idea of who she was, and it helped, she did restore her memory eventually. And she said there was no, an MRI of the brain was negative. There was no traumatic event that she's aware of. She hadn't, there was no physical evidence of being assaulted or anything. And so she was very nervous. You can imagine how hard you guys study. And then she felt like she couldn't trust her brain really, that she might wake up someday again and have no memory. All right, so uh, an additional thing. Some people will call this a different one, but it's actually a subtype of dissociative amnesia. And this is dissociative fugue, and this kind of fugue state, it's somebody that's had generalized amnesia where they forget who they are and they just kind of go away. And it's easier to find people now because of the internet and how everything, our IDs are scanned and everything. Um, in the old days before the internet, the old days before the internet, people could be in the same area and they've left and started a new life, and they might have that life for the rest of their life. All right, so this is the one that gets a lot of attention. Dissociative identity disorder. It used to be called multiple personality disorder. I may have mentioned this before, but the American Psychiatric Association, when they are updating our DSM, the Diagnostic Statistical Manual of Psychiatric Disorders, they like to try to, once a disorder is kind of famous in the public, they like to change that, and they also needed to make it more descriptive and more accurately descriptive. Multiple personality disorder would sound like a personality disorder, and it's not a personality disorder, it's a dissociative disorder. And so this was, a good renaming of it as well. There was also people that like to get attention would say they have multiple personality disorder. We don't see that as much now with dissociative identity disorder. I think the last famous person I heard saying they had it was Roseanne Barr said she had it, and Herschel Walker, the former football player that was running for Congress in Georgia, I believe it was Georgia. Anyway, um, so this does exist. I know there's some people that think it's a myth, but it does exist. I've seen it, and it's well established. And anyway, it's two or more distinct personality states. Usually, there's many more than two, because once your psyche splits to deal with a stressor, it's much easier to do that again. And let me explain that in detail. All of us have a side of our personality that can deal with stressors that are kind of unique. Um, the person that's developed dissociative identity disorder, usually what's happened to them is they were being sexually abused or physically abused when they were very young, and it's a defense mechanism to disassociate, to kind of escape into your mind. And if it's goes on and on and on, you develop like a side of yourself that can be so firm and rigid, it becomes almost a whole. It's like a whole different personality. It's a whole different identity that's within you. Um, this is a normal process that's kind of gone crazy with the person that's under, being traumatized, and it's usually a chronically abused, somebody that's being molested every day or every couple of days by somebody in their household. Um, that's a common one, and so they learn how to escape into their mind, and that's how it's a defense mechanism. Um, like I said, it's normal that all of us we don't have different personalities within ourselves. We don't feel that we're different people, but if you think about it, I'll give you an example from my life. When I was young, I I couldn't speak in public, and then had to give a book report in front of an advanced English class that I got into in 12th grade. Before then, I'd been kind of a goof off student, and so we didn't really have those kind of assignments. In the 12th grade, I got into an honors class, and it was different. It was everything mattered, and I went up and I just kind of had a full panic, and I couldn't talk, and I had to go sit back down with a bit without being able to do my book report in front of the class. And so, I had never had that situation before, so I didn't have a part of my personality developed to deal with it. Now, as you probably know, I speak in public a lot because I'm a college professor, and that's part of my job, and I like it. And but it's not who I am when I'm relaxing at home, when I'm laying on the couch watching TV or something. It's a part of my personality that deals with a certain situation, but it's still me. Um, all right. We'll talk about this in the class discussion. I'm not sure I'm explaining it as clearly as I would like to be. All right, so as you look here, so they're each alternate personality, which they call an alter, sees things different, and it makes sense. You wouldn't have different personalities developed to deal with different situations and then have them seem the same. There's usually one personality that can be aggressive toward other people, and that you can imagine that came in handy when they were being abused. There's another personality that's like a really young child that's needs to be protected. Sometimes the aggressive personality is mad at what we call the host personality, which is the actual person, the real personality of the patient. Um, yeah. All right. So characterize dissociative identity disorder characterized by the existence of two or more personalities. Um, like I said previously, most of the time they have much more than two, but they need to have two to qualify for this disorder. um, they those personalities are developed usually for a certain function. There's one that's like really childlike. There's one that's aggressive and stands up for the patient, and there's one that is like it's like the superego with Freud, where it's really critical of the patient and sometimes will make the patient hurt themselves. Um, and some the host personality, the personality that's the real personality of the patient, we call that the host personality. It's like they're hosting all these alternate personalities. um, Sometimes they'll be afraid of that aggressive person, and the host personality, the real person, will have names for the personalities most of the time. All right, and then when the person gets stressed, they will do what we call switching, and what it means is they'll switch to the personality that they think, in their system thinks can handle whatever the stressor is. We try to encourage patients not to switch on the unit because that's when they can act out. The third and final type of dissociative disorder we're going to talk about is depersonalization derealization disorder. In this disorder, just like in the title says, depersonalization, you feel like you're not yourself, like you're not connected to yourself. Sometimes you're kind of seeing yourself from above. Derealization, like it sounds, it feels like life isn't real, like things that are happening aren't really happening. And so there's a change in the way you feel about yourself. You're not really aware the way you normally are. Things don't feel real. Your body doesn't feel like it normally does. You feel detached, like nothing really matters. Like you're not connected to anything. Um, and then you have a sense that you're kind of seeing yourself from the outside. So on this slide, we have the definitions. Depersonalization is a disturbance in the perception of oneself. derealization is an alteration in your perception of the external environment. In other words, you don't feel like you, and life doesn't feel like life. Symptoms of this disorder, frequently people are really depressed. They feel like they're losing their mind. And so they'll go to doctors a lot. Obsessive thoughts, somatic complaints like, there's something wrong with them physically causing this, brain tumor, um, disturbance in the sense of time. Time doesn't feel like it's progressing the way it normally does. It's usually the experienced student patients usually express is that it's kind of slowed down. Predisposing factors to dissociative disorders. Um, remember, Freud believed, and the psychodynamic community believes it's a defense mechanism that's repression, and there's a lot of evidence that traumatic experiences overwhelm the person's ability to cope, and so your coping skills are overwhelmed. And what this next sentence says, that those type of experiences are usually sexual abuse, physical abuse, and psychological abuse. And what's important is it's a kind of abuse that you can't physically escape from, and so you escape psychologically. And then dissociative identity disorder, it's a survival strategy. It's a defense mechanism, and it's a way to get through. It's a way to survive. So the nursing process, we wanna restore them to our normal thought process, which means not using these defense mechanisms of dissociating to deal with whatever comes up in your life. Remember, with the most famous one, dissociative identity disorder, they develop a side of their personality that becomes like its own personality, and so that's why they have these multiple identities within themselves. So what we want is them to learn how to cope with stress without disassociating. Our ultimate goal for the patient with dissociative identity disorder, we want to bring all those fragmented personalities, we want to bring them all into the host personality. In other words, the the real person. We want to, what people with dissociative identity disorder will say when you're trying to work with them. Sometimes they'll say, "You want me to kill off all these people that live within myself?" And we tell them that's not what we want. What we tell them is all of those personalities are part of you, and we want you to bring them all together. You know, where they're like with we call normal people, where we all just have sides of our personality that can deal with different stresses, but we don't have separate personalities to deal with each stress. And so we want them to be integrated into the personality of the host person, the regular personality. All right, so looking at our objectives for this lecture, dissociative identity disorder, this is the presence of two or more distinct personality states, which we call alters. Um, in other words, alternate personalities. And each of them has each of these personalities, these alternate kind of fragmented personalities, they have their own pattern. They have their own body language, their own way of seeing things, and their own way of relating to others. Um, and and they can actually look like very different people within the same person. Um, Yeah, so they have those different ones. They differ from the host personality. Like I probably said earlier, sometimes the host personality is aware when they're come out, and sometimes they're not. Um, there is they're sometimes affected by the actions of each other, and sometimes they're not. Right. Dissociative amnesia. So the three types of dissociative amnesia. Well, first of all, dissociative amnesia, it's the inability to recall important personal information. That's not just your ordinary forgetfulness. It's not just because you got, you turned 40 and now your memory's failing, or, like our normal, or our memory's not as good when we get older. It's not just ordinary forgetfulness. It's not due to any kind of medical condition. The person doesn't have dementia. They're not on any illicit drugs or anything like that. It can be explained by that. And so we have our three types, which the first type we talked about localized amnesia, where there's a traumatic event and the person can't remember anything about the traumatic event for a specific period following the event. So their memory is intact about the rest of their life, but they can't remember the specific, the traumatic event. Then we have selective amnesia, where they're only able to recall certain select incidents that are associated with a traumatic event for a specific period. Those sound similar, but with selective, it means they do remember the traumatic event. They just can't remember certain parts of it in there. And so that's the distinction. And then generalized amnesia, where the person totally forgets everything from their past. All right, and then we just talked about depersonalization, derealization disorder. Oh, let me go back to number two, dissociative amnesia. Remember the famous subtype what we're talking about there is the dissociative fugue, where the person just kind of picks up and leaves their life and starts a new life somewhere else. And this is not conscious. It's not on purpose. And usually there's some kind of traumatic event that happened, but that's not required for the diagnosis. Okay, and then depersonalization, derealization disorder that we just talked about, where the person they don't feel that like themselves, they don't feel connected, they feel like maybe they're watching their life from above or from outside themselves. And then the derealization part where they feel like nothing's real. And that can be dangerous because they feel like they won't feel pain, they won't, that sometimes they'll do things like really that are dangerous that hurt themselves in an effort to try to prove to themselves that things are real. So that can be dangerous in that way.